Thank you for coming to participate in TEFI's and P2R's Infection Prevention Lecture 307 called Sterilization. Today's lecture will be a brief introduction on sterilization practices in healthcare settings, specifically talking about the foundations of sterilization, what the practices involved, and how we monitor. Today's lecture will be recorded and it applies and can be eligible for a different level of continuing education. If you're new to this lecture space, the first bit of the lecture will be providing lecture material, and then we'll go into a learning activity, which I encourage everyone to participate in, and we will provide a QR code. And then after the end of the learning activity, we'll open it up for questions. So I ask all questions remain to the end. Again, today's lecture will be recorded and is eligible for different numbers of CEs. And within approximately a week or so from today's lecture, you will receive a link to the recording of today's lecture along with additional education steps that you can take to claim your continuing education hours. So let's begin. My name is Dr. Kayla Rush. I have a PhD in epidemiology, and I'm a seasoned infection preventionist with experience in acute care, long-term care, and skilled nursing facilities in the United States. I conduct research on IPC education training and work to try to help provide better education so we can have better outcomes for our patients. And I work here at TEFI, which is the Texas Epidemic Public Health Institute, which is housed in UT Health Houston School of Public Health in Houston, Texas. And our goal at TEFI and our mission is to really help prepare Texans for the next infectious disease outbreak by providing more education, training, early detection, and communication. As I mentioned, this lecture is eligible for continuing education hours through the Texas Department of Health and Human Services. To obtain your continuing education hours, you need to sit through the entire lecture, complete the post-test learning activity, and the post-test evaluation based on today's lecture. It has been approved for continuing medical education or CNEs for nursing continuing education hours, along with certified health education specialists, public health, and registered sanitarians. This lecture has also been approved from the Board of Infection Control for an hour of continuing education for any of those that hold a CIC, a certification in infection control, or the APIC, which is the Associate Infection Prevention Certificate. For one disclosure, I am a consultant for BD, but I will not be talking about any of their products today or kind of any relations that I have with that company. I don't endorse any specific products. This lecture is not talking about products specifically and just providing more education on this area. Today's learning activities, as I've already mentioned, will be to define and describe some foundational sterilization components, and really our goal is to understand the process of sterilization and then how we can apply these skills to our monitoring practices within our organization and our facilities. So let's begin. So what is sterilization? So sterilization is a process used to make a product, such as the piece of equipment, free from all living organisms. It is usually conducted in your sterile processing department, or SPD, which disassembles pieces of equipment, sets them through certain equipment, such as a sterilizer, to be processed to deem it as sterilized. Sterilization and SPD play critical roles in reducing risk of surgical sites infections, along with other components of HAIs, which are healthcare acquired infections. Anytime that you have a spike in your surgical site infections or your SSIs, it's a really good thing to be mindful about the processes of sterilization and check with SPD that no process has changed. There hasn't been any equipment failures when you're doing some of your case workups to see if the root cause of the SSI has been due to a failure in sterilization practices. So under the Spalding classification, we have three main groups, which are non-critical items, which requires cleaning and disinfecting, which we've had a few other lectures in the TEFI 300 series specifically talk about that. And these are devices that come into contact and use with patient skin or use on the external of a person. So your blood pressure cuffs, some of your other like external equipment that you use in your environment, and that multiple patients will come into contact. The next level is the semi-critical items, which require high-level disinfection, which that lecture was provided last month under TEFI's 300 series. And if you didn't get a chance to participate or attend that lecture, I encourage you to go on to the TEFI IPC YouTube page and review that lecture. It talks specifically about high-level disinfection, the different processes, what's involved, and how to monitor that practice. And those devices come into contact with your mucosal membranes or non-intensity. So that's a lot of your scopes. So doing your colonoscopies or your upper EDGs, your bronchoscopies, some of your cardiovascular scopes that you use, that falls all under the semi-critical classification of equipment that requires high-level disinfection. Today's lecture, we're specifically going to talk about the critical items which require sterilization, and these are reusable medical devices that enter our sterile tissue or body cavities. So that's a lot of the things that we use in our ORs or any types of procedures, anything that's coming into a sterile area or a body cavity that we're using requires a sterilization level and is deemed a critical item. So some of these items, and there is a ton of them, especially when you get into very specific surgeries, is of having very unique devices required for them, like some things with neurology cases with certain implants, some spine things. There's very specific equipment that will be used in these surgical cases. So this is just a couple of the groups looking at your surgical instruments. The main common ones are always your scalpels, your retractors, forceps. Then any implantable devices, those will always require sterilization and then making sure that you're in compliance with that specific device with their manufacturer instructions for use or the MIFUs of how it needs to be sterilized before. Also be mindful if at your organization you are having vendors come in and provide certain surgical sets, certain implants that are coming into, make sure they always have a backup or multiple sizes that have already been processed, that they have been sterilized and they're ready to go. So in case that the surgical team undergoes any hiccups in their during surgery, such as the device is too big, it's too small, someone accidentally drops it on the OR floor, you have another device ready to go and you don't have to make any type of flash sterilization or other difficult choices or keep the patient under anesthesia until you get another implant ready to go with an increasing different risk of being under surgery for a longer time. Another big thing that needs to be very mindful, any dental or oral surgical instruments, or if you oversee a dental clinic, all those devices should be sterilized, and making sure that they are sterilized properly. If at your organization, say you're a long-term care, and you have a dental clinic come in on every, once every 2 weeks or once every week or different days, that all of those devices are being sterilized. If you're a long-term or skilled nursing home and you need sterilized equipment, since anything with scissors or forceps or a scalpel or anything like that, and you're getting that from a third party, we'll talk more about that in the lecture as well. You are still responsible to make sure that they have been sterilized appropriately and they're within compliance and they are safe to be using on that patient. And then other types of miscellaneous instruments, depending on what type of surgery that you're doing or the patient population that you see specifically in your organization. So we have the devices that get sterilized, and during each sterilized cycle, you will use a couple things to ensure that quality and safety have been maintained. One of these things is called a chemical indicator, which you can see here on the slide is a specific strip. It goes into the cycle with the device to ensure quality control. This device measures to make sure that the chemicals and the pressure and the time and heat have all reached the appropriate threshold to ensure that it has been sterilized or properly. For a chemical indicator, it goes into every single packet. So every pill pack that you have, every tray, every item that goes through sterilization, they should have a chemical indicator in them. And it should be placed before it goes into the sterilize. And then when you're coming out, you should be able to check it and be able to see that, yes, this has met and achieved the level that it was supposed to. A lot of these chemical indicators change colors. You can see on the bottom right with one of the chemical indicator strips, you can see that the purple dot is really after it passes through and it has maintained the temperature that is supposed to get to, it will turn light green. So a lot of these are chemical dependent and there's a color change. Make sure you look and read the package of what brand of chemical indicator your organization is using and knowing what the color changes are and what it's meant. Also, when you're auditing, and we'll talk about more of this later in the lecture, ask the staff if they know what this means and that they know that this color means a pass, this color means a fail, and what they should do. So every pill pack, every device should have a chemical indicator in it to help ensure that the sterilization process is done so far appropriately. We also have a biological indicator, which is a test that contains a specific organism to ensure that has also passed sterilization. And before, these can be run once a day, once a day is mostly recommended. It doesn't have to be every cycle, but make sure you look at your organizational policy and procedure of what you've decided that you want to do. If you're running them every cycle, great. They don't have to be in every device in every cycle, not like the chemical indicator. So when you're putting it in the, going back to the chemical indicator, if you have 10 trays in there, you should have 10 chemical indicators in each tray to ensure that it has reached the proper level. And then a biological indicator, you just have one packet and they're kind of in a bigger packets and they go into the load. And then you'll see a color change. So with this one, you want a no color change means that it has passed. If you see a color change, as you see here on the picture, it means that it has failed and there's bacterial growth within that device, which you do not want. So again, make sure that you look at what biological indicator your organization is using. And if you are wanting a color change, not wanting a color change, and what does that mean with the color change? And is it just a one color change? Is it a gradient of change? What exactly? So again, make sure that you are looking at the manufacturer instructions for use or the MIFUs, specifically for your biological and chemical indicators to know what colors mean what and what it's supposed to be meaning at your organization. And then also referring back to your policies, a chemical indicator should be used in every single wrap pill pack in the cycle. So you'll have multiple chemical indicators in the cycle, but you should just have one biological indicator per load. Unless your organization special, you can always up it if you at your organization, if there's been a problem with an auditing or there's been a breakdown in repair, running them more often is a great way to ensure that compliance is being maintained and everything is being killed as it's supposed to, and that you don't have any residual bacterial potentially in that area. If you ever have equipment that you're not quite sure is running irregular, you're worried about system failures on your equipment, running extra or running more biological indicators in them can be a way to ensure that it is up going to compliance, and depending on what type of device you have, looking at the manufacturer of how many times they recommend running in it too. So just different things to be aware of when you're doing sterilization practice based on your organizational policies and then the equipment that you are using. So under sterilization, there are many different chemicals that we can use in processes. Then the most common one is steam sterilization, and compared to ethylene oxide, compared to dry heat and hydrogen peroxide, there's different risks to the environment and also the staff that are involved in this area. So kind of this steam sterilization is a little bit, it has been kind of deemed safer because there are less volatile compounds that come off of that when staff are unloading and loading the sterilizer, that they're not exposed to for any type of upper respiratory issues. There's also a caveat of what equipment that you have. Not everything can have one type of sterilization or another. So again, making sure that you go back to your instructions for use and specifically look at how that device should be sterilized, if it's okay to use steam, if it only requires ethylene oxide, hydrogen peroxide, or dry heat. As I just talked about the biological indicator, there are two main bacteria types that we use in sterilization. We have our Geobacillus stereothermophilus and our Bacillus aerofacius of different types. And as you can see here on this nice condensed chart, that the different types of sterilization require different bacterias. The indicator forms can be done differently. And then also the typical connections are changed. So make sure that you know what specific type of sterilization that you do in your facility, what conditions are required, and if they're being met. So sterilization occurs in the sterile processing department, or SPD, and the role of these individuals are crucial to make sure that we are sterilizing our sterile surgical instrument and storing them appropriately to ensure patient safety, to help reduce surgical site infections and reduce harm events to patients due to lack of sterilizing equipment correctly. Their core responsibilities are cleaning, disinfection, sterilization, inspection, and packaging of these instruments. They will also store them and distribute them in sterile processing. And their goals are that they have huge compliance with the manufacturer's instructions for use, or the MIFUs, as I've mentioned, and also the Association for the Advancement of Medical Instruments, known as AMI. They are the ones that put the standards of what the equipment should be ran at, the pressure, temperature, air exchange in these areas, along with a couple other organizations as well, to make sure that these equipments are maintained and sterilized appropriately, to make sure that we're providing great care to our patients and not increasing harm. These individuals have specific required competencies based on what is deemed within their field. They should be having training and certification within those areas, especially if your sterile processing department is understaffed and you get travelers, which there is always a high need for sterile processing staff. It seems like a lot of organizations are usually short these individuals. They should have certain training specifically to your organization, and then also through their certifications. As you see listed here, there's multiple certifications that they can have to make sure that they know the proper policies, procedures, and protocols. As we kind of already seen, that there is variation in sterilization practice. If you're using hydrogen peroxide, ethylene oxide, or steam sterilization, the processes and time and temperatures and thresholds are different, along with what bacterial indicators are used. So you want to make sure that if you have new staff, they are provided with copies of your protocols, procedures, that they know specifically what is going on in your organization. So they know what the equipment's used, how to become familiar with it, and to ensure compliance. Also, you want to make sure that they know what they're working with. They know the physical demand of this department. We're using good ergonomics so we don't have any back strain, knee pain, slips, trips, and falls from these areas. And then also because there's a potential risk of inhalation from different chemicals that we're using in the areas, that we know what N95 to wear, or we're wearing a PAPR, how to don and doff PPE appropriately so that we're not contaminating ourselves and we're not contaminating the sterilized equipment as well. As I mentioned, these, or as I kind of alluded to, all these areas need to be audited to ensure compliance, specifically with the AAMI standards. And you want to really look at the point of cleaning, transportation to these areas, the different sterilizing equipment process, so the different sterilizers, the different ultrasonic washes that you're using, the different sterilants that you're using in that area, and then also then verify the cleaning and sterilization process. So that's looking at your load logs, your chemical and biological indicators, and visual inspecting the equipment. And we'll talk more about that in the last section of this lecture of how to monitor. So now we're going to go into the second section of really talking about the sterilization process. So in most facilities, there are 4 main areas of sterilization. You first have your first area, which is decontamination. That is where the contaminated equipment comes in. So ideally from a procedure room, any equipment that has been opened during that will come back and be disassembled, will be cleaned, and just cleaned, and make sure that you're understanding that the first area is washing it using different things to just clean it. It's clean. And then we go into the second area then, where we have clean equipment that has been ran through different either washers, mini sterilizers, use different types of equipment on it, and now it's deemed clean, not sterile, clean. And this is where we start looking and doing the visual inspecting, making sure that it's good, there's no rust, it's not damaged. And then now we're starting to package it in our trays, in our pill packs that we will go into the sterilizer. So making sure that we have our chemical indicators in those pill packs. Then we go into the third area, which then the clean equipment is then loaded into the sterilizer that you're using, or the sterile equipment room. And these rooms can be adjacent. They're usually in different corridors. And that is where the actual sterilizer is located, that they are going to then be put in with our biological indicators to be ran in the sterilizer, and then it runs for a certain time, temperature and pressure within that device. And then afterwards, you remove the now sterilized equipment, and then now you store it in sterile processing. And I'll talk more about these areas specifically. So under multiple AAMI and ASHRAE regulations, time or temperature, relative humidity, pressure, and air exchange are different within these areas. So you're to these specific standards that you can see, always double check if you're in an older building of what specific standards and what building code that you have to follow. Making sure that you know the new codes, and then if your building has been grandfathered in for other things of what you've done. So decontamination, you should have a temperature range in relative humidity or within this, and then the pressure in that area should always be negative because it's a bunch of dirty stuff. And then also have a minimum of 10 air exchanges per hour or more. Then you want to go, as I mentioned, it's dirty. Now we're getting cleaned. It's ran through like a washer, and then you're going into the clean side where you're packing it. So that has a different temperature or relative humidity, and that should be positive pressure compared to from decontam. So negative pressure in decontam means that the air is being sucked in, and positive pressure, since it's clean, means pushed out. Because you don't want new air coming into that clean environment with certain particulates and bacteria that are suspended in air, then landing. And then you have your air exchanges as well. Then you have the next room, which is your sterilization relative to temperature, humidity. It should be negative to the packing area, and then the level of exchanges, and then you have your sterile storage, where after the equipment has been ran through, then it's being stored. Make sure if you have these in logs, if these are digital thermometers within your group, that you have some sort of tracking ability to ensure that the temperature and relative humidity are within limits. Anytime it, especially in Texas, when it's really hot and humid, or if we have a hurricane and lose power, that if the humidity and temperature exceeds this, then to know that you have been alerted so you can take out and reprocess all this equipment as well. So be very mindful of that. Also be able to check in your emergency management plans of that this stuff is on backup generators and you know how and when that's going to kick in as well. So as I've already kind of mentioned with the decontamination and cleaning area, this area is specifically to remove organic and inorganic material from it. So this is where we're manually cleaning. We're using different brushes. We're using ultrasonic cleaners, washers, disinfectants in that area. And we're physically getting off all the debris. And then it will be for this first step. During this, make sure that the brushes that you're using or that sterile process is using, you're auditing, you're looking at them. Sometimes if the different brush little fibers, they can break off and they can get lodged in things, such in different canals, and then they come out during surgeries. They can poke staff members. So making sure that you're inspecting your brushes as well to make sure that they're good, they're not shedding. There's no breaking, cracking of anything like that too. Also during decontamination, when they're cleaning and setting through that, there should be a visual inspection, making sure the equipment's looking right, there's no cracks, they're doing leak tests, they're depending on what they're working with, that they are too also looking at that if the equipment itself. Another thing of this area, sometimes you have the preset dilutions of chemicals that you're using. Ask about how those are being calculated, if Biomed's looking at them in your system that you have. So you want to make sure everything looks good, it's all functioning, and there's no buildup, corrosion, or damage to those pieces of equipment. So then after it's cleaned in decontamination and then sent through either a pass through or kind of depending on what your flow of your organization looks like, it should go to the clean assembly and preparation areas. So we want to make sure everything's disassembled. Nothing should be pre-assembled in this area. We are, again, visually inspecting the equipment. We are arranging our equipment in different pill packs, as you see here on the graphic with the scissors. Anything that has a hinged needs to be completely open. So scissors, any type of equipment that has a hinged device of whatever you're looking at needs to be open, because if it's not open, when then you place it in the sterilizer, you're not having the steam or the chemicals that you're using fully cover that surface area. So if it's closed and it's blocking, so it's two pieces on top of it, that sterilant that you're using in the sterilization isn't getting into that surface, and it can have areas of opportunities where bacteria is still there and it's not being cleaned. It's not being sterilized. You also want to make sure that there are spacers to keep things open depending on what you have in your area. There's also for any pointing device that they're not poking through the pill packs, that maybe you have little caps that you're putting on them. Again, go back to your area at your specific organization and see what they're using. You also want to make sure that they're not being stacked super tight. You want enough space where air and the different steam or chemicals in the sterilization process have enough time and space to get in there. And you want to make sure like everything is open, that for any sharp objects that are going through the sterilizer, such as little tips that you have different caps on it, and that you're not overpacking the trays. The maximum weight is 25 pounds. If you overpack them, sometimes that then leads to people using bad ergonomics to pick up the tray. So you have potential staff safety events because they're getting hurt. And then they're also then not using good ergonomics. Maybe they were leaning forward, leaning back, and potentially contaminating it too. So making sure that the weight limit, and that when you're auditing it, that it's within the weight parameters of the trays. The next thing then would be looking at your sterile monitoring. So like in your sterilizer, making sure that you know what the mechanical indicators are. So that's the specific load printout. Each load should have a cycle time, duration, temperature, if it's passed, making sure that you look at that. And then also, where is this information being stored? Is it digitally uploaded? Do you have a binder in that area? You also have a log with the chemical indicators that I've already mentioned of being ran and your biological ones as well. Also with a count sheet, they know what goes in the sterilizer and what comes out, and then your internal chemical indicators as well too. So then, as I kind of already mentioned, the sterilization actually printout, you want to make sure with your different trays that they are wrapped appropriately, they're in the right wraps, they have external packing tape, they're in appropriate containers that should go into the sterilizer. They are labeled in some way, shape, or form with your load number, your date, your sterilized number, the items that have been going in it, and the person that prepared it, so that you have audit tracing that you can go back and say, like, someone looked at it. This is also really helpful if there's ever an outbreak investigation, either due to equipment failure or if you're having issues with certain surgical site infections, to go back and look at this. Joint Commission and CMS will also be looking at this too, so it's a good thing just to have this process really down pretty quickly, that you can produce these logs with this information. And then lastly, then looking after it comes out, you should be able to visually see that it has been sterilized. A common thing that we use is the external chemical indicators, which is the type that changes colors from the white, as you see on the slide, the lines of white meaning it hasn't been sterilized, and the black means it has been. And then going through that, when these items are sterilized after the cycle has been completed, you're able to remove them safely. They've cooled down, and you can safely transport them to the sterilization or the sterilized equipment storage area, that it's clean, dry, it has maintained temperature, humidity, and then it's organized. Also, what your shelf life is, of how long at your organization, if you want it to be re-sterilized, if it's good forever, looking at the different AAMI standards, and then your specific organization, if you're saying that, no, we want this recycled every X amount of times, or if it hasn't been, used in this time, we want to re-sterilize it and reprocess it. Those are other things to be mindful of. Can you all hear me?
Yes.
Okay, great. All right. So during the sterilization process, you want to start in the OR observing. And then you want to go with the piece of equipment after the surgery procedure has concluded. You want to go physically with the equipment. During that time, after surgery has been done, you want to make sure that any visual tissue or debris is wiped down from that piece of equipment, just like in high-level disinfection. You want to make sure that it's placed in a leak and puncture-proof biohazard transport container, and it is sprayed with enzymatic spray, which reduces the bioburden on that specific device. And then it's nicely covered with a lid, and it's transported to the dirty side or the decontamination side of SPD. There you will monitor SPD of how they disassemble it, looking at it, ensure that all the equipment is still wet from the enzymatic spray. I encourage you during this process to also look in some of the other bins, maybe not just the one that you're being transported with, but additional bins, the bins before, the bins after if you're there. You will watch the individual in decontamination, disassemble, clean, use different solutions, and then run it through the washer into the clean side. Well, then we'll take it to the packaging on the clean side, doing our pill packs, place it in the sterilizer, look at afterwards how the mechanical sterilization has been performed, remove from the sterilizer, verify your cleaning process, and then where it's stored in the equipment. And we'll talk about all of these in details. Okay, so the first thing, just like anything, when you're going to another department, make sure that you are scheduling an appropriate time. If you are going to stay for this whole audit trail, this can be like a full day's worth of work. It could be a half day's worth of work. If you're just doing a specific section, that's great too. Making sure that you have enough time and coverage with other things in the IPC department as well. You always want to make sure that you talk to OR or where this procedure, where the sterilized equipment is going to be used, making sure that they feel comfortable about it, that they know it. It's not an emergent case that it's being done. And then also that the whole area of SPD, the decontam, the clean packing, sterilization, and the sterile storage of the equipment area knows where you are. Because usually, depending on your facility, this might be run by multiple leaders, same person, depending on how big it is. So anytime you can schedule a time to go in, asking for the MIFUs or the IFUs beforehand, so you know what is being used, how it's being used, what it should be using. This is a good way also to ask appropriate questions during this time, since you have just read the manual of, you can quiz the staff, because this is great practice for them too, to make sure that they're ready for when Joint Commission, CMS, or anyone else comes in and audits them. Also know what PPE they should be wearing and how they should be moving. So you can do your OC EPI and your healthcare safety EPI and partner, or if you oversee the employee health safety program as well, making sure that everyone's staying safe by using good ergonomics so that we're not bending, twisting, potential fall risks in these areas. And then if you're new to observing and you haven't been into sterile processing, always ask if you can observe a more senior technician or a senior leader in this area so that you can have your questions answered completely and they have enough time and they can speak to a lot of their processes. So at the point of care or wherever, in the OR, that you're making sure that they were the first step of removing any visible debris from them. Ask them what type of cloths that they're using. They should be lint free. That they are visually inspecting the equipment too. I mean, they don't need a long visual inspection, but if something drops or breaks during the in the OR during the procedure, it's being identified and it's being removed out of circulation, and that's been communicated. If there's any channels or canals within that piece of device, ask if there's anything stuck in there. Another good thing is all other pieces of tissue have been properly taken, labeled, and sent down to pathology and not accidentally put in the decontam or it hasn't been thrown away. That's another thing just to be mindful there. And after they wipe down and remove the gross debris of that species of equipment, they're going into a biohazard leak and puncture resistant container. As you see here, labeled with the biohazard symbol. The equipment should neatly fit in there with the lid on. And it shouldn't be too heavy to carry either. Next, before they put the lid on, you want to make sure that you visualizing seeing the enzymatic spray. Also ask the staff how long the enzymatic spray is on and making sure that they are spraying enough that it stays wet. You can look at the expiration dates. When was it open? When does it expire? And how long is the duration? Some enzymatic sprays are only good for 12 hours. Some are good for 36 hours. What is what does the MIFU of your enzymatic spray at your organization say what it's good at, making sure that you know what's being used at your organization and that staff knows what's being used there and how it should be used. Then after it's sprayed and the lid's put on, you will physically go down to the decontam or dirty side of sterile processing. You want to observe to see, is there a system where it's communicated? Are trays just dropped off? Are they in secure locations? Are they out in the hall? Are the doors propped open? What's going on? Observe those practices to make sure that we are making sure our facility is staying safe with these equipment. There's somewhat of a way of a chain of custody of these pieces of equipment, that we know how it's being communicated and what the process is for getting that equipment down to where it needs to go. Then during contamination, you want to make sure that you're observing the individual with all steps of the decontamination, disassembly, cleaning, using brushes. Look at, as I mentioned before, what type of brushes are you using? Look at the brushes, the quality of the brushes, ask them how long they keep a brush. Is it a new brush every time? Is it brushes for X amount of time? What's being used at your facility? Along with other devices that are being used, make sure that you're checking the logs. If you have any systems that have a pre-calculated dilution factor for your device, such as like you have a decontam sink that's X big and they fill the water line here and that's supposed to be a 10% dilution. How do they come up with that? How is that being checked? How is that being maintained? The preset systems that put the dilutions of the chemicals, when was that last checked? When was it in service? Is that biomed, or does the vendor itself come out and look at that? Do we have logs for last time it was serviced? Check the dates on chemicals, making sure everyone knows what PPE to use, that they're being compliant with their PPE, and they've had the appropriate training and documentation for this areas. After you see them do the decontamination,
You're muted again.
you're on the clean side, that you are seeing how it's being packed. You're checking that those chemical indicators are within the pill packs. They're sorted appropriately. There's enough space. You know what the weight of the tray is. There's also not a staff member from the decontam side going onto the clean side. There should be separate staff for this area. And if there's not, then what is the process for changing PPE going from one area to the other? Because you have a very dirty place to a clean place, making sure that we don't have contamination due to environmental contamination of walking, touching certain areas within that, that our staff kind of stay separate. And so there you're observing the equipment, you're making sure everything's open. They have their silicone protectors on the devices if need be. And then after it's being put in their pill packs and they're ready to go, then you go over to the sterilization area where the sterilizer is and making sure that they are prepping the sterilizer appropriately, that nothing's overweight. We have our chemical indicators, our biological indicators. If the biological indicators have already been ran that day, you see a copy, you look at it, you see the printout, the documentation. You can look at how they stored the load cycles. You want to make sure that you know everything is numbered, that if you're having multiple sterilization cycles, that they're numbered accordingly, and whatever mnemonic or numbering scheme that you do at your organization, if it's day, time, if it's a specific number, if it's a color, however you want to do it, as long as that you can speak to your process, especially when it comes to audit or when you're doing an investigation for an outbreak situation, or a follow-up of surgical site infections of going back, you have a way that you can trace back the pieces of equipment as well. So then after it's been ran through the sterilized side, then you will look at, after it's complete the sterilized process, you look at the printout, you see that time, temperature, and duration has been set. It has passed. You want to make sure then you're inspecting the instruments, that you're looking at them. You can see the changes in those external indicators, that they have changed appropriately. Again, when we have these now sterile devices that have been ran through the device, what type of PPE is the individuals that are taking them out of the sterilizers into where the sterile equipment is going to be stored? What PPE did they put on? New PPE? Was this other PPE that they're wearing? Look at that. Look at their process of changing PPE, and then also transportation. What area and how are they getting this sterile equipment into the sterile storage area that it's supposed to be in, and follow that path as well. To make sure that you're not accidentally going back and decontam, that your path is clean, and that you're not going into neutral air area either. So those are other things too. It's really important that you audit and monitoring this, because to make sure that there's a high risk consequences of things break down in sterilization process. Essentially, it's going to be harm to our patients by potentially exposing them to a device that has not been sterilized. So you want to make sure that you have a plan at your organization, how often that you are monitoring it. It should be done monitoring regularly, depending on your staff flow and kind of how much pieces of equipment that you're using at your organization. That will also affect how often you should monitor it, and if anything needs to be going on. If you've had an increase in surgical site infections, I would be meeting with the surgical teams, observing the surgical teams, specifically that type of surgery. If you're having a specific, maybe you're having more colo procedures, have SSIs or hysterectomies. Going to those procedures, watching them, talking with the staff, looking at the PPE, looking at the environment, and then looking at the equipment, along with antibiotic stewardship as well. Making sure that you're really taking the time to audit this. And I know it's a long time to audit this. This can be a very long process and a very long day. So making sure that, yes, it is a lot of work that you're doing it, because at the end of the day, it comes down to safety for our patients. Okay, now I know that was a lot of material, and attend multiple choice learning activity. So I invite you to scan the QR code. You can put your answers in the chat as well to participate. So I'll give it just a few more seconds for you all to scan the QR code, and then after we do this, I'll do a couple announcements, and then I'll open it up for questions. Great. Question 1. What is the primary purpose of sterilization in healthcare? Is it A, to improve staff knowledge, B, enhance environment, C, eliminate of all organisms, or D, reduce equipment costs? Awesome. Yes, this is an easy one. It's to eliminate all organisms on equipment. 2, which of the following devices are deemed they needing critical device and require sterilization? Is it a stethoscope, blood pressure cup, scalpel? Awesome. Yes, that's great. The correct answer is C. 3. What is the gold standard of effectiveness in sterilization? So do we do visual inspection? Do we use chemical indicators, biological indicators, or D? That's great. Yes, D, all the above. We want to make sure, and you don't want to rely on just one of those things. As I've mentioned, you want to be looking, inspecting, making sure, and then looking at your chemical and biological indicators. Question 4, what department's primary responsibility for conducting sterilization practices? Is it A, environmental services, B, central supplies, C, sterile processing department, or D, radiology? Great. Yes, it is C, your sterile processing. Question 5. What is the function of a chemical indicator? Is it to measure moisture? Is it B, to confirm presence of organic debris? C, verify one or more component? Or D, detect corrosion on surgical tube? Ah, great. Yes, it's C. It would be great if we had another indicator to detect corrosion, but we don't. And then B is our biological indicators. That's what those are used for. C, according to Amy, what is the maximum weight that the tray can be? Is it 10 pounds, 15, 20, 25? Yes, it's D. It's 25 for safety, to making sure that we do not use bad ergonomics, aka lifting inappropriate. So we have our healthcare safety events for our staff, and OC health or employee health have more injuries on the job. And then also that we're not accidentally then using bad ergonomics and then potentially contaminating the clean sterilized equipment because it's so heavy we have to do something, lift poorly. Question 7, why is the pre-cleaning critical? Is it to A, reduce noise, B, improve packaging, C, to remove debris, or D? Yes, that's right. It's C, to remove debris. I didn't fully mention, but I talked a lot about in the last lecture, in the high-level disinfection lecture. If you do not if you do not remove the biofilm, if you don't remove the debris, it can cause a biofilm, which kind of shields the specific device, and it will cause it can create a barrier where the sterilants can't get in to effectively clean it and disinfect it. So that's always why we want to remove that, to make sure then later in whatever practice in sterilization or high level disinfection that we have, it is effective. Question 8, which of the following is not a responsibility from an SPD personnel? Is it A, instrument disassembly, B, sterile field setup in OR, C, equipment sterilization, D, distribution reprocess item? Yes. The correct answer is B. Sterile field setup should specifically be done by the circulators and like the OR team of how to set things up. Question 9. What should be used for the external verification of packaging undergone? Is that the A, internal, B, biological, C, mechanical printout, or D, the external chemical tape or label? Yes, that should be D. The external chemical indicator should be that visual inspection that, yes, we know at least in one thing has passed, and that's that tape that I showed you in the presentation that will have a chemical change. And then our last question, question 10, what certification is recommended for SPD personnel? Is it to have an RN, a CIC, a CRCST, or ACLS? Yes. The correct answer is C. We want to make sure, just like our field as an infection preventionist, there are certifications and within every specialty, making sure our staff have that, and then that they are conducting annual, triannual, or biannual training, specifically within your organization, and that those records, either the sterile processing leader has, they also have submitted updated information for their certification, and that's either with their leader or HR. So then during survey time, when they're pulling employees' records to look at this, making sure everyone has been trained appropriately, that's there within the files. So here are the correct answers, if anyone has questions. And then to kind of wrap up, sterilization really helps prevent HAIs by eliminating specific organisms going into the sterile field. Our SPD partners are crucial to making sure that everything is done appropriately within compliance, that everything's disassembled and packaged correctly, along with monitoring our biological indicators, our chemical indicators, and our mechanical indicators, and making sure that we are all compliant with our MIFUs and AAMI standards to ensure safety. So I invite you all to connect with us. Here are a couple, if you want to email us directly, it's IPC. Here's the QR code. And now I have a couple announcements as well before we get into the question section. So the first announcement is that TEPI has its annual public health summit later this or next month in September. On the 25th, registration is open. It is a hybrid event. You can come in person or attend virtually. It is free. So we invite you all to partake in that. The QR code for registration is here. With this series, the big announcement I want you all to be mindful of is that the TEPI 300 series is moving platforms. So the September, October, and November platform will not be Zoom like it is today, but we are moving to Microsoft Teams. So if you have registered for these upcoming lectures, you will have to re-register. So let me repeat that. If you have registered for the upcoming September, October, November lectures, you will have to re-register. There will be an email sent out with more information along with the registration links. If you have questions, please email me at ipc@tefi.texas.gov. I'm more than happy to send you the registration links. And with that, the next thing that we're doing is I'm piloting a new IPC office hours. It will be next week from 2 to 3:30, and this is an informal. It will not be recorded. You cannot get continuing education hours, but this is an area for IPCs to talk, to network, to collaborate, to discuss what's going on. And to really learn from each other. The expectations of this group is that to be courteous, professional. I'm going to ask everyone to mute their mic and unless they're speaking, and if you are disruptive, then you will be asked to leave the meeting. So if you an email went out earlier or an invite went out earlier last month about this for August for next week. If you do not have the link, please email me. I can forward you the invite. And then the last announcement is that our next lecture, which is 308, which is Emerging Infectious Diseases, will be on September 4th from 2 to 3 on Teams, which you will need to re-register for. And we will be discussing the 2024 Rwanda Marburg outbreak, and then talking about the dengue and H5N1 status here in the United States. So a little bit different, but kind of seeing of what went well, and how we can use this information as IPC for emerging pathogens of what we need to do next. I ask you all to complete the post-survey evaluation, which you see here. And then for those who have asked about the previous work, the TEFI lectures have 100 series and 200 series papers have been published. They're here for your convenience if you want to take that a look. All of those lectures have been recorded. They're on the TEFI YouTube channel under TEFI IPC YouTube. You can go back and watch those lectures. And then if you are interested in containing continuing education hours, of how to complete that. And now I will open it up for questions. I know that was a lot of information. So for the question to Sharon, the QR code, there will be an email sent out for you to re-register with a registration link for the upcoming lectures so that you can see it on the new platform. And to Simone, the TEFI webinars, they have all been recorded. All the lectures have been recorded. As I mentioned at the beginning of this lecture, today's lecture is recorded. Within a week or so, you will be provided with a link to today's recording along with the slide deck. All the other lectures, you can go on to TEFI IPC's YouTube channel and rewatch them. The question about, do you have a checklist for your ORs or surgery? Surgery, the checklist, it really depends on what surgery, what device, what type of surgery. AORN is a resource. They have checklists to go utilize when you're looking at surgery, of knowing the pre, the post. Also, if you're auditing surgery in the whole OR area of like where like the pre-op is, post-op, or the PACU during the OR. It really depends on the specific equipment that's being used. That's why there's no big like cut and paste checklist. That's why I recommend meeting with them, scheduling. There's also good Joint Commission, I believe, and maybe CMS used to have some OR, just general environmental checklist of, the pressure, the cleaning, the storage, the corridors for the ORs. Those are really good to use. I think you have to pay for them though. That's another tool that's out there for checklists in the OR. It really just depends. And then also like what type of surgery that you're looking at. But some big things of looking at, of making sure people aren't going in and out. Antibiotics, anesthesia is giving the appropriate antibiotic prophylactically before surgery, and the right dose and time for that surgery. So under your antibiogram with your committees, that you should have specific antibiotics for specific procedures, and then also redosing time, making sure that's in compliance. Also, when you're doing SSI workup, making sure you look at that. That's another thing I kind of look at. Also kind of depends on just a lot of things. So long and short, no, there's not a standard checklist, but different organizations have ones that I would pull different chunks towards to make a better one for auditing surgery. Anytime you can meet before, and kind of, especially if you're new to surgery, if you can meet before and get more a standard case or something that isn't emergent, it's easier for you, especially if you're learning, so you can get some IFUs. You can see what equipment that they're using. They know how to process it. You can kind of read up on the surgery that they'll be performing, or you can maybe then ask other senior your OR manager about certain procedures that's going on. That's another thing I would recommend if you're new to the surgery space. Any other questions? I know that was a lot of information, and a lot of it's depicted about what specific surgery and what specific equipment you are using at your facility. Okay, well, if there are no other questions, I thank you all for attending today's lecture. I hope, oh, sorry, there's one more. If a sterile packaging is sitting on the shelf and we want to re-sterilize it, does it have to go through all the steps again? I would say yes. Yes, I would say I would treat it that it's dirty, because it still should be washed and go through your whole cycle. Especially for auditing purposes, you should never want to skip steps. That it should be, if you're pull it out of the pill pack or the box, send it over to decontam, have them wash it, run it through, and go through the whole cycle. Sometimes I didn't talk about, but there's flash sterilization that is not recommended. That's for some other things. And that's a more tricky situation, but I would, if you have a process in place in your organization, especially when it comes to sterilizing, do not if you can never modify from it, that's the best. Because if something happens, they're gonna specifically ask you, why did you veer from your processes and your procedures for that? And especially if it's a negative outcome, it can open you up to more issues down the road. So no, just I would you could just have them, clean, throw it in like another dirty set that's something already on decontam side. You wouldn't have to get its own like little crate. I would just throw it in one that's already being processed there for it. Any other questions? Okay, great. Well, I hope to all see you next month at let me go back. I hope I'll see you first next week at office hours. Please come. This is a space for IPs, about IPs, trying to network, share things, try to be there for each other. And then I hope to all see you at the lecture in September, talking about emerging infectious diseases and looking at different pathogens. As well, please re-register. If you have questions, please let us know. You'll see the new flyer that will be sent out as well. It'll have the new link. It'll be on Teams. If you have questions about registering, please email the IPC email. I'm happy to help you get re-registered. And thank you again for participating, and we'll see you either next week or next month. Thank you.